right? A transient infection means just that. It comes and then it goes, right? They can have a variety of symptoms, anything that I mentioned earlier, right? When they're sick, they show symptoms and they spread the virus. And they may spread the virus for a couple weeks after they recover. These animals can develop secondary infections and die, but if they do recover, they will have immunity for a short period of time. Now, the other type of infection is a persistently infected animal, right? These guys appear healthy, but they have a lifelong infection that we can't treat. These animals will shed the virus in huge amounts. It will be in their manure, it'll be in their urine, in their nasal secretions, and even in their saliva. These calves usually don't look sick. However, their immune system will be lower, so they're vulnerable to other diseases. And a lot of times they kind of just look unthrifty and don't grow as well. All right. I want to take just a minute to talk about the immune system because that's important when we start talking about these persistently infected, right? The immune system is the body's way of protecting itself, right? It kind of think of it as security guards. It goes throughout the entire body, and when it finds something foreign, something that doesn't belong, it attacks it. That's when we get the swelling, the inflammation. If you can see in the picture, the normal bubblegum pink lung becomes really, really angry. All right. So the calves is identifying the virus as foreign. All right. Usually after the infection is cleared, you develop immunity, or after a vaccine is given, because the immune system knows what to do the next time it sees the virus. All right, so now I want to talk about these persistently infected calves. Okay, to become a persistently infected, the mother is actually exposed while she's pregnant, right? And she's got to be exposed before that critical 5-month mark. All right, at 5 months gestation, the calf develops its own immune system. So if she is infected before that, and the virus is around while the immune system of that calf is developing, the immune system will never see it as foreign. It just thinks that the virus belongs. So the virus will be in every cell throughout the entire body. And now I know I said a minute ago that it can cause abortions, and it can. So if a cow is infected before 5 months of gestation, she may abort the calf, or she may give rise to one of these persistently infected calves. All right, so here's a picture. I'm a visual person. I don't know about you guys, but if you look at one insemination as being bred, whether that's artificial or by the bull, that's the day she got pregnant, right? That first month, we can have the early embryonic loss, which most of the time you don't see that. You just see her come back in heat after a month or so, right? Late in gestation, you can see the pictures there of deformities or abortions that aren't full term, or stillborn calves. The problem is that 2 to 4 month zone. During that time period, she may abort and come back in heat, or she can give rise to the persistently infected baby. So why do we care? If I said that it's shedding it in high numbers in its saliva, nasal secretions, manure, it's spreading it everywhere, right? Think about a group of calves coming up to a water trough, and you've seen them after they get a big drink of water and the saliva, hanging from their mouths. They're infecting every other calf that's drinking in that same trough, right? But there's good news. We can test for it. A test can be performed on blood or nasal secretions, but the test on blood, only detects if the virus is there at that moment. So blood tests really can't determine if it's a transient infection and it's there and they'll get over it. or if they're going to be persistently infected. Right? The other test is called an ear notch test. Right? Right. So for the ear notch test, you actually take a sample, a little triangle is cut out of the ear. I've got a picture of the ear notcher there. And you'll send that sample to the lab. Now, most likely, if we're finding the virus in ear tissue, they're going to be persistently infected. Occasionally, you can retest them, but most of the time, a positive is a positive. Once you get the sample, as you can see, kind of cut out, you can just put the little piece of ear into a Ziploc bag and with a Sharpie, write the calf's number on the bag. Now, that does mean they have to have ear tags in. I did once get into a situation of, calf testing positive and nobody had ear tags in, so we had to retest. There are chute side tests that can be done on the farm. Right? These tests can be expensive. While I say chute side, it still takes 20 minutes, which is longer than we want to leave our calves in a chute at once. Samples may be pooled, so you can actually test like multiple calves at a time. The problem is if one of those calves come back positive, you've got to go back and test each one. If you want to do the chute side test, I recommend consulting with your veterinarian and having them be there at least the first time you do it. All right. Well, we can get around some tests by, you don't have to test the entire herd. All right. If you test all of your calf crop on a cow-calf farm, if the calf is negative, then you know its mother is. Right? If the calf turns up positive, then you need to go back and test the mother because the mother could be a PI as well. Right? Anything that didn't calve, obviously bulls, we can't use that to screen them, and yearling heifers that haven't calved yet. And here's the thing that, people forget, but if a cow did not calve, or if her calf died before you tested them, they are automatically a suspect. Because if she aborted or she didn't breed, why didn't she? And BVD could be your answer. So while you don't have to test every cow, if you're testing calves, those that didn't have it's really, really important to test those that didn't have a calf to be tested. All right, general vaccine recommendations. Modified live is a virus that's been manipulated in the lab, right? They take the virus and they manipulate it so it causes a really mild form of the disease. But you will see calves show some mild symptoms after you vaccinate them. It can lead to infertility in cows or some reproductive problems. Right? Killed vaccines, on the other hand, right? These vaccines, the virus has killed itself, and it's mixed with an adjuvant, which will bring the immune system to it and show the immune system what it is. These are safer in breeding age cattle, but they don't get as strong of immune response. All right. So what we recommend is weaned calves do a modified live vaccine and then a modified live booster. Research has shown if calves are vaccinated and boosted with a modified live at weaning, then as they become cows, the killed vaccine is just as effective and safer. If you get a cow that has an unknown vaccination history, I would use the modified live the first time, but make sure you don't do it within 60 days of breeding season. All right. Other prevention methods that we can employ is decreasing stress and providing adequate nutrition. Those are mainstays of just supporting the immune system. Make sure you have minerals out with selenium, right? We want to do the testing protocols to remove any of those PIs because, like I said, those are the silent sources that are affecting everybody else. All right, vaccinations, follow the protocol. If if you have any questions, feel free to reach out to me or KSU. All
Dr.
right. Well,
Lay,
yes, ma'am.
we have a couple questions. Jackie asked, do stockyards test for this before selling?
They do not. Um, and buying from reliable sources. You know, if you want to buy large groups of calves, it may be difficult to find enough calves at one source. But, however, the CPH sales, they do require that farmers use modified live vaccines. I don't know that they require the test, but Beth might be able to answer that in just a minute.
Also, if the stockyards, if not, do the stockyards require each person selling at the stockyard to do their own testing and provide the results?
No.
They do not either. This is a voluntary program, right? By preventing it on your farm and testing for it, you're going to remove those economic losses from yourself.
And
but
one last,
it's not required.
Sorry. One other from Buddha, he asked, is milk safe at this time if they have this?
Yes, this doesn't affect the meat quality. This doesn't affect the milk quality. So even if an animal is persistently infected, if it's slaughtered, this is nothing that humans can catch. Okay.
Thank you.
All right. Quarantining new animals. Of course, we've all got this new social distancing and trying to get used to, you know, kind of a new way we're doing things. I often see people that will have a quarantine pen. When they get a new animal in, they put it in a pen by itself. But remember our 6 feet rule. If the calf is somewhere where it can be directly across the fence from another animal, those aren't 6 feet apart. So make sure you have at least 2 fences between your quarantine pen and any other cattle, right? When you do bring an animal into the herd, make sure you test it and then vaccinate it before you turn it out with the rest of your animals. And last but not least is limiting your travel between farms. Let's say you work at the sale barn, have a different pair of boots that you wear when you're at the stockyards versus when you're on your own farm. And just follow all the biosecurity guidelines. So now I'm going to turn it over to Dr. Johnson. She is the field veterinarian with the State Veterinarian's office. They do currently have a control program, but it's voluntary for farmers. So I'll let her go into a little bit more on that.
So I'm Dr. Beth Johnson. I'm the field veterinarian for the in the Kentucky Department of Ag State Veterinarian's office. I've worked quite a bit. I came on in 2013, and in 2014, the Kentucky Cattlemen's Association said, "Hey, we got to do something about this disease that's affecting our cattle." And I actually have a registered Gelbvieh herd where we were completely closed, and I actually experienced a PI BVD calf due to a cow being vaccinated with a killed vaccine and exposed during the show season. So it is possible, even if you are closed herd and just practice artificial insemination, you could possibly be infected with BVD. So Dr. Lay did a wonderful job of telling you what bovine viral diarrhea is about. I'm going to probably reinforce some of those, repeat some of those, just for the simplicity of reinforcement. This is a really insidious disease. You may not know that you have this disease until you realize, hey, I'm not getting as many calves as I normally get every year. Or you see an abortion, or the calves are born and they just they fail to thrive. And then also you can have some PI BVD calves born that completely appear normal. They perform great. until something possibly comes along and infects them. That PI-BVD calf can be just rocking and rolling right along, doing great, and all of a sudden the virus mutates into the cytotoxic mucosal disease, and that calf will be dead within 3 or 4 days. And it's a pretty, incredibly invasive virus. The calf will develop ulcers from its mouth all the way to his rectum, internally. And so you can imagine what type of, that it's a pretty devastating disease. But not all calves develop that. Very, very few actually develop mucosal disease. Like I said, it's usually insidious and causes immunosuppression, but a PI-BVD calf in a group of calves is constantly shedding thousands of viral particles every day of its life to its cohorts and causing transient infections in all of the cohorts. This is how a PI-BVD calf is actually produced. We have a cow that inhales probably the BVD virus into her lungs. It then enters the bloodstream usually and crosses the membrane in the uterus and infects the calf. If that is done in the first 150 days of gestation, this virus can set up, and you never know that the calf was ever infected. The calf is born, looks completely normal, and he immediately, or she immediately, starts shedding viruses. So, PI calves are created during the pregnancy. Usually a cow that's not properly vaccinated. Dr. Lay described to you how you need to really use a modified live in your weaned calves. I recommend 30 to 60 days prior to the breeding season that you vaccinate with a modified live vaccine. I know a lot of our producers have a bull in with them year round. That kind of prevents you from utilizing a modified live vaccine on your older cows. But if you will vaccinate your weaned calves and give them a booster before breeding, that will really protect your cows down the road. One thing I want to stress is that if a calf is born persistently infected with BVD, it will always be persistently infected. You cannot cure this disease. If a calf is born not infected with, in other words, not a persistently infected calf, it can't develop persistent infection after it's born. It's the only way you can get a persistently infected calf born is it's infected in that first 150 days of gestation. BVD does not pose any threat whatsoever to human health. Consuming the meat or the milk, that was a good question earlier about the milk. So dairy cattle, or a family's milk cow, that's PI BVD. Although she, like I said, is transmitting the virus to all the other cattle in the area. The other thing that is extremely important in my field is that it is a reportable disease in Kentucky. All of the laboratories that operate in the state of Kentucky, there's the one out in Hopkinsville, Murray State University Breathitt Diagnostic Lab, and then the one in Lexington, the University of Kentucky Veterinary Diagnostic Lab. And there's also dependable livestock testing in Bowling Green that are actually Smith's Grove. They all report to us if they have a positive PI-BVD calf. I generally get those reports if I recognize that it's somebody that I've not seen with a positive calf. Most of our positive calves are actually backgrounders or stockers that purchase the calves at the stockyards. They test, they know why, they go ahead and test these calves. It's extremely important for them to know because it really reduces the drug cost if you don't have any PI calves in there. But I follow up on the PI positive calves. Once again, you've got this little calf that's emitting virus particles. That little calf is actually can infect another cow who can create another PI calf. It can infect a bull that's in your herd that's not properly vaccinated, and it can infect its cohorts. In a background or a stocker operation, that's extremely important. So one of the things you want to do is try to control it. Dr. Lay did an excellent job of telling you how to vaccinate, how to test, to control this disease. Biosecurity, boy, we've heard that word enough this in the last month, but that it truly is a effective way to minimize infection within your herd. Test all of the herd for PIBVD. Test all the calves. Test any cow that did not have a calf. Any yearlings that are not due to calve in the next year, and any herd bull needs to be tested as well. Anything you bring into that herd needs to be tested, and that's extremely important in that first 14 days that you got that animal up in quarantine. You know, the quarantines it's not just for BVD. It's for foot rot. It's for parasite issues, any type of respiratory disease. You know, BVD is just one of many that cause respiratory issues in cattle. Always work with your veterinarian on a herd management program. When you do test your herd, it is extremely important to remove all the positive BVD cattle from the herd. Try to vaccinate with a modified live vaccine against BVD, and prevent the introduction of BVD into your herd. Once again, who do we test? We test all calves, any cow or heifer of breeding age that did not have a calf that year, and any replacement heifers, any bull in the herd, and any new herd addition. So what happens if you have a PIBVD positive animal? Well, they'd have to be removed from the herd. There's a couple of ways you can do that. You can put them down. A lot of backgrounders and stockers know how important it is to get that calf out of there. And a lot of times, you know, if it's a 200 or 300 pound calf, it's cheaper to just go ahead and euthanize that animal and properly dispose of that animal than it is to keep it around and feed it out. You can, if they're 600 or 700 pounds, go ahead and process them. The meat's fine to eat. If they're only 200 or 300 pounds and you've got a place that you can quarantine them away from the rest of the cattle, do so. Feed it slaughter weight, especially if it looks healthy. If it doesn't look healthy, if it looks sickly and it's PIBVD positive, go ahead and euthanize it. You're not going to get that calf feeling better. We would, you know, we don't have at this time any permitted feedlots in the state. We've always would love to have somebody decide to do that. If a calf is transported to a permitted feedlot, it does need to move under our with a permit from our office. One thing that cannot be done is these calves that are PIBVD positive cannot be sold back through the stockyards, and that is actually a regulation. The Kentucky statutes 257.040 states that any person that knowingly has in their possession, you know, and moves an animal that has a reportable disease, which BVD, remember, is reportable, that's against our regulations, and they are subject to fines, and at the very least a fine. And if you sell that animal to a person, you could be charged with a violation that way too. And at this point, I've pretty much concluded the control. Just remember, with BVD, work with your veterinarian, work with your extension agent. A lot of them know about this disease now. And, you know, this picture here demonstrates BVD classically. Both of these calves are PI-BVD positive. The one on the right, you can easily tell is sick. The one on the left looks like a great performing limousine, doesn't it, Jesse?